Joining us today is Dr. Jacques Fontaine, surgical oncologist at Moffitt Cancer Center. And Dr. Fontaine is here to talk to us about the advanced surgical options offered at Moffitt Cancer Center. And Dr. Fontaine, tell us why patients should seek surgical care for their cancer at Moffitt.
Well, good morning. If you have cancer, you want to seek the best treatment possible. You want the best chance of a cure. And Moffitt Cancer Center is about cancer and cancer only. So if you have a heart attack, don't come to see us. If you have a car accident, don't go to Moffitt. If you need a hernia repair or if you need hip surgery, don't come to Moffitt. But federal statistics have shown that cancer patients treated at Moffitt Cancer Center have higher rates of a cure than other Florida patients treated elsewhere.
That is great. And how is surgery at Moffitt different than a local hospital?
Well, simply put, it's because we're lucky enough to be on a league of our own. Our surgeons are ultra specialized about doing cancer surgery for one specific body part. I do the same surgery over and over and over again for cancer in one specific body part, and we all work together that way. And for example, my father asked me, isn't that boring to be doing the same thing over and over again? But whether you're shooting a basketball, whether you're playing the violin, the more you do it, the better you become, the better your results. And that's what differentiates us at Moffitt from other hospitals.
That's a good point. And speak to us specifically about esophageal cancer and how you're helping patients.
Esophageal cancer is a tough cancer, and the treatment for it can be quite tough. The treatment involves chemotherapy and radiation, but it also involves very complex surgery. At Moffitt Cancer Center, we do the most esophageal cancer surgery in the southeast of the United States. And we're now doing it robotically. What does that mean? That means that I do the surgery by making small incision and inserting a 3D, very high-definition camera, little instruments, which I control myself as a surgeon using a machine, a complex machine called a robot. So it's not the robot doing the surgery on its own, but it's rather me as a human surgeon controlling the instruments using a very precise tool that we call a robot. So we do a lot of these surgeries, and the difference between doing an esophageal cancer surgery with a robot versus traditional cuts is the fact the cuts are smaller, there's less pain, faster recovery, and less chances of a complication. And our statistics show that.
Yeah, that's great to know that there's that kind of technology out there. And Dr. Fontaine, thank you for being here with us today to talk to our listeners about the advanced surgical options offered at the Moffitt Cancer Center. Thank you.
Thank you.